Well, hello, everyone. Welcome back to another edition of Oracle Health Inside Access, our opportunity to share a peek behind the curtain of our latest and upcoming innovations. I'm Shauna Adamick, Executive Director of the Oracle Health Foundation, and I'm delighted to be your host today. Before we get started with our guest on discussing how we are transforming healthcare globally, I want to touch on a few housekeeping items. To help maximize our time together, let's make this a two-way dialogue. I highly encourage each of you to submit questions and feedback with the Zoom Q&A function. Members of our team are standing by, ready to engage and answer your questions. So now that we have that out of the way, let's shift gears and let's welcome our first guest. Well, I am so thrilled to be sitting here with Marc Levy, the Executive Vice President of Software Development for Oracle Health. And if you don't remember, Marc was one of our very first guests on the first episode back in November. And it's a pleasure to be with him again today, because I know that he and his team have been hard at work. And I am excited to talk with them about their accomplishments and also a little bit about what's to come. And I'm actually going to refer to my notes on this because the what's to come in that conversation, this is a list of things. I mean, because we're going to be addressing some of healthcare's biggest and most complex challenges, including focusing on core EHR functionality, a digital assistant, patient portal, patient administration, API-enabled innovation, rev cycle systems and payments, health data intelligence, clinical and business operations, interoperability, and a clinical data exchange. That is a lot of incredible work, and I can't wait to get to it. But first, I just want to say, Marc, thank you so much for taking time to talk with me again.
Well, Shauna, very happy to be here, and it's kind of nice, to come back. 6 months after our initial conversation, it gives sort of a chance to look back and contemplate what it is that we've been doing and what the road ahead looks like. So I'm looking forward to our discussion.
Absolutely. And it doesn't feel like it's been 6 months. And I know that you all have done some incredible work. But before we get there, I actually want to step back even just a little bit further. And could you share with us discussions that you had with some of the other leaders related to the vision to improve health globally? What are the challenges that Oracle wanted to address in health and why?
Yes. So maybe let me take it from the remarks that Larry Ellison had at the recent Oracle Health Summit that took place in Nashville. And his basic point was that in order to really have an impact on healthcare, you need to address the plurality of challenges that's facing healthcare, and that failing that, just continuing to make little point improvement here and there is simply not effective. And he also sort of the bookend to that, the complementary part to that is that it's also something that we cannot do alone, right? So healthcare, and this is a theme I think that will reoccur in this conversation, and that is very present in my mind, is an ecosystem. It's really a set of industry that connect with one another. So you really have to think about it that broadly. And yet, if you don't want to find yourself in a situation where you're trying to boil the ocean, you really have to have a starting point. And for Oracle, of course, I think we can trace back to the Cerner acquisition, even though Larry Ellison himself has, of course, been involved in healthcare for many, many years. But from a Oracle Corporation standpoint, really the big launch point of that was really the Cerner acquisition. And then I'll conclude this kind of answer to your opening question by simply saying that, look, if we were to do nothing, whether it's as an industry or as a company, it's very clear that the healthcare prospect in general are not fantastic, right? There's an enormous cost pressure, et cetera. So I'm really glad to participate in this mission, to bring, again, this sense of mission, of bringing what it is that we can from our technology experience to the table to really help in healthcare as much as we can.
Yeah, absolutely.
Hope that made sense.
Yeah, no, it absolutely did. I mean, you said a lot of great things in there, but I want to I appreciate also the candidness of just saying, hey, this is complex. I mean, healthcare itself is complex. And, I loved how when Larry did make a point to say, we can't do this alone. This is a together moment, and it would be boiling the ocean if we were by ourselves. And so this is something that, impacts us all, whether we experience healthcare or we're helping to change it. I mean, everyone's going to be on both sides. And, going back to that Cerner acquisition, that's one of the things that we talked about 6 months ago, and how, going, from that moment and everything that your team had to dive into, the challenges, the fixes, the methodologies, the things that were to come. So from our last discussion on that, where are we now?
Okay, yes, interesting question. So let me start by taking a step back and just try to reestablish the context of our work and how we're approaching it. And I hope this is going to sound familiar, because it's nice to have a strategy, but really a strategy is worth nothing if you are not executing on it. And really, in the past 6 months, that's really what we've been doing and what we continue to do, right? Is executing. And you'll see in a second that, in fact, the overall strategy has not really changed much since you and I last spoke, or since we met with many customers at Cloud World last October. And fundamentally, the work in front of us is an example of dealing with a balancing act, right? So, and if I were to try to summarize it, what I would say is that we have to meet our customers where they are, and at the same time, invest in new capabilities. And we have to do this while minimizing disruption for our customers and enabling them to take this journey along with us, right? So that is, in a very, very broad line, our strategy, and as you'll see, what we are executing on right now.
Yeah, absolutely. The balancing, I think that's, interesting for you to mention, and meeting our customers where they are, helping them be on this journey with us to make this transformation in healthcare. Tell me more about this. Let's dive into this a little bit more. Can you give me some examples? Talk to me about investing in new capabilities.
So maybe let me start with what I mean when I say meeting our existing customer where they are.
That would be great. Yes.
So to me, that means first delivering on the high priority functional requirements that we need to satisfy, like right now, right? Mm-hmm. And working with our customer in terms of adopting those enhancements. I mean, one of the things that we don't talk about very often, but it's just a reality, and it's frankly a reality for the industry, in addition to being very present for us, is that it's all fine for us to enhance the product, to create brand new thing, but ultimately the value comes once the clinicians at our customer actually use these enhancements, right? So in addition to delivering the feature function, it's also essential to work in partnership with our customers in terms of adopting the enhancements that we produce and the new experience that we provide. Mm-hmm. And for us, in the past period, this has been especially focused in the clinical area. So there we have delivered improvements in documentation and charting, and in medication and orders, in service lines and department, in mental health, and so on. And we've done that, and we have a roadmap of further improvement that we'll deliver over the next few quarters. But in addition to that, we're also working closely with our customer to bring them up to date from a tech standpoint, to upgrade them really, to deliver better operational performance in terms of reliability, availability, bugs that cause system crash and hangs, system responsiveness overall. And again, one thing that is important, I think, for the audience to understand, and it's been very, very clear on this journey, is that this work is done in partnership with our customer, right? It requires work on their side, it requires work on our side, and then together we can really bring to fruition all of this kind of combined work that we're doing in actually impact. So that's one thing, meeting customer where they are. Did that make sense?
Yeah, that absolutely did. And I loved being, how you pointed on different things and really using that example too, to be able to help us understand. I mean, we're getting to a great place, and we're even going to an even better place. And so helping our customers along the way be part of this journey is a big piece of that. So thank you for going into that a bit more. And so then kind of diving off of that and talking a little bit more of investing into some new capabilities. Talk to me about that.
Very good. Yes. So again, it's one thing to meet the customer where they are, but if that's the only thing that we're doing, that would not be sufficient, right?
Right.
So in terms of investing in new capability, I would say that thematically the work is organized along three primary axes. So the first axis is really to provide transformative user experience that make the work of our provider better, that relieves burnout, and that enhance their productivity. AI is front and center as the enabling foundation for that. Now, a second axis is picking up a theme that I mentioned at the outset, is recognizing that healthcare is an ecosystem.
Yeah.
So that starts, of course, with the patient, and then they're the provider, their payers, there is pharma, their government entities, such as the CDC, for example. And then the recognition that almost every activity in healthcare spans several of those stakeholders. So we are heavily invested and investing in connecting the ecosystem, whether it is at the data level with the health data intelligence product as an example, or whether it is about helping our customer integrate workflow that span these stakeholders. So for example, all the interaction between provider and payers during the course of caring for a patient. So again, around that, in addition to the health data intelligence that I already mentioned, there have been continuing improvements in HDX, our payment processing platform. By the way, that payment processing platform was instrumental in helping our customer navigate through the Change Healthcare cyber issue that happened a couple of months back, and where we literally have been able to reroute billions of dollars worth of claim around the fact that Change Healthcare was effectively offline. Another product that we're doing is the clinical data exchange that automates some of the clinical data exchange that are required to settle claims between provider and payers. And then I would say beyond, because a lot of my example are around provider payer, but our ambition extend beyond that. So for example, we are also working to better integrate our clinical trial products with provider workflows so that more providers can participate in clinical trial and do so more easily and get paid for that, right? So that's a second axis, recognizing that healthcare is an ecosystem, and then I enumerate or I give example of a few products that play in that area. And the other thing I would also say there, because it's near and dear to my heart and was frankly a bit of a revelation for me in healthcare, is that an important complement to the payer provider work that I mentioned is the work that we're doing that is more provider-centric to significantly reduce the administrative cost of care for provider. And there, as examples, we are launching a new patient portal and a new front office registration schedule module with a number of customers that are already in beta. So the modernized portal and the front office introduce significantly more self-service and automation. So that really helps manage the cost of administration. And then the other big thing that we're doing there is that we're pushing very hard in the back office with Revelate. So Revelate is effectively the replacement solution for a Cerner patient accounting. We have now our first production customer that are online. They've seen significant financial benefit from using Revelate already. And as just maybe a reminder to our audience, Revelate is built on the proven Sorian patient accounting that is already in use at our dozen of customers. And our effort there, sometimes again, it's about digging trenches, is really to accelerate the migration of our customer. And we're doing that through automation and through standardization with excellent progress there. And then also, and not unimportant in healthcare, unfortunately, is cybersecurity, right? Because as you know, a week doesn't go by when we hear about a participant in healthcare who's been affected by that. So the move to OCI is a key foundation of that. We've already moved over half of our customer to OCI. We started with our PowerWorks customers. We have also moved a few of our large customer to OCI, and we have strong plans to move many of them in the coming years, and then all of them shortly after that. So,
wow.
Yeah. So maybe to summarize what we did, Shauna, is that we are executing on this program that we announced at CloudWorld and that you and I spoke about last time. And what I'm really proud of, even though there's still a long road ahead, is that how far we've come and that we are in fact doing what we said we'd do. That's really very important to me, right? To show that, we don't make empty promises, we say things and then we go do them.
Yeah.
So again, sorry for being so long-winded.
No, I mean, that just shows your passion about this. And I love that. And, we're doing what we said we were going to do. And I'm going to pull out something that you said, and that is that we're invested in connecting the healthcare ecosystem. And that's, we're invested in transforming healthcare to create intelligent care. And that's what all of these pieces of this comprehensive platform is that you're talking through. And it's incredible to see this journey that you've been on over the past 6 months and the journey that's to come. I mean, I can feel it, I can hear it in your voice, and the exciting things that are on horizon that are already in the works. So thank you for sharing a little bit about that with us. And I'm excited to talk to you 6 months from now and go back to this question again and talk about that and where we are at that point. So kind of moving on from that question into the next, I want to focus on something because we're coming into the close in the next few questions. I want to focus on something that's rapidly growing since the last time we talked, and that's artificial intelligence. So how is Oracle making AI real in healthcare, Marc?
That's it's a fantastic question, Shauna, and one that is dear to my heart. The first thing I would say is that I think AI has a very special potential in healthcare. And I think the reason for that, there's several of them, right? One of them is that the fundamental work of doctors and nurses is the caring of the patient, right? So it is not actually work that primarily has to do with computer, right? So it really has work that has to do with people. And so first, I think AI has this potential of moving the computer to the side when clinicians are with patient, enabling a much more natural, direct interaction with patient and practicing medicine in the way that it used to be practiced, and that sometimes providers who have practiced for a while are nostalgic for it, and I think for very good reason. So that's one very important where, I think the potential of the AI can be fairly unique, like in healthcare. Secondly, I think AI can really relieve the administrative burden that contributes to provider burnout and then also impact the effectiveness of provider. So that's, I think, another real problem of healthcare that AI can help solve. Then more in another area, more purely administrative, AI can also help reduce the administrative costs from the front office to the back office, say with AI-supported coding, for example. And then finally, AI can help with decision support, including in the clinical area. So those are 4 example areas, right? So supporting direct interaction with patient by clinician, relieving administrative burden for them that contributes to provider burnout and increase their effectiveness, and then reduce administrative costs in the front to back office and help with decision support. So again, these are not small things, right? It's not like a little feature here and there. These are really in the meat of what it means to practice medicine for the healthcare provider. So that's the potential. Now, I want to be a little bit careful here so that I don't scare anyone. All of the work that I'm describing today follows the principle that I enunciated at the beginning of our conversation, which is that the stuff that we're doing has to minimize disruption for our customer, and in particular, make it possible for them to implement and adopt incrementally. So what I'm about to describe, even though the user experience it delivers is quite novel, works with the Millennium that you already have side by side, etc., doesn't require data migration, etc. But we are really working to go through all of the workflow and really apply AI to this workflow in a kind of from the ground up way that really brings all the power of AI around summarization, around recommendation of next action, around the ability to ask ad hoc question of the system and have them answer without having to root around the UI, complex menu system, and the rest of that. So that's one thing that we're doing, and that is itself rooted in, frankly, the decade-long experience that Oracle has with conversational AI around, for example, the Oracle Digital Assistant product that we've had in market for years and years now across many different industry. So, and I think you're going to hear a little bit more from Dr. Patel in a bit, just after our conversation here.
Yeah, absolutely. Well, thank you. Thank you for that. I mean, it's exciting to watch. I mean, it's come so far since last time we talked, and even to see where it's going to go. I mean, you know, we know what we need to do and the role that AI plays and our comprehensive health platform. I mean, this is the bridge that we've so desperately needed in healthcare, as you said, to empower the physicians to refine the patient experience so they can feel seen, heard, and valued, remove barriers to data, administrative support, and so much more. So it'll be exciting to come back to this question. And also thank you for pointing out that we'll be hearing from a customer here soon. And I love that you said minimize disruption for our customers, because again, it goes back to just helping our customers be part of this journey, not be at all their work be interrupted by this journey, but be on this journey with us. So thank you for that. You know, so finally, I want to go to something that I want to touch on that I heard in a recent presentation of yours, and that's that intrinsic impact of working in healthcare. So can you talk to me a little about the most memorable or rewarding moments that you and your team have experienced while creating solutions in the most complex challenges in health?
Yes, yes. Look, funnily enough, I think maybe I'll answer the question the following way, but in two sort of bookends, right? On the one hand, I would say that it's incredibly rewarding to work every day in the trenches, so to speak, right, with my colleagues, with the doctors and nurses that we have in the organization, with the software developer, of course, in this journey. On some days, tackling what feel like very mundane problem of making sure that the system is as highly available as possible. Occasionally, you know, doing root cause analysis of incident that we might have. But on other day, talking about exciting new functionalities. So certainly, that's kind of the engineer day in and day out life. And it's amazingly rewarding to me to be able to do this in this healthcare context where you really feel that you're delivering sort of impact that the people around me that are not technical people can actually understand, right? I view this as a tremendous privilege to be able to do this at this stage in my career, and I'm incredibly grateful for it. So that's kind of one thing, right? The day-to-day, et cetera. But then the other thing, and perhaps connecting back all the way back to the beginning of the conversation, when we were talking about Larry's remark in Nashville, you know, here is another way to think about the road ahead and the potential scope of what we need to do as a company, as an industry, as a society, really. Mm-hmm. Global healthcare spend is about $10 trillion a year. That's with a T, $10 trillion a year. In the US alone, we spend $4 trillion per year. And yet, when you look at the EHR market, the traditional EHR market, it's around 30 billion. So with respect to the US, not quite 1%. So look, I'm not saying these things to talk about money. I'm talking about those things so that one can gauge a little bit what is the amount of value that we bring to the market. And what I'm saying is that I am convinced that we can bring more than 1% of value to this market, to patient, to provider, to payer, etc. There is much more value to unlock, many more ways to already put money back into the system so that we can afford the healthcare that we're going to need. So to me, that is kind of tremendous. It's really exciting in terms of sort of gauging the space that we have to actually realize really transformative impact. So that's kind of another way to look at this.
Yeah.
I'm really excited to be working on this thing with people such as you, Shauna, over the next few years, and to actually deliver on that tantalizing promise.
Absolutely. Well, I love that. I love how you said that. And, to pull out something else that Larry had said in Nashville, I really appreciated when he said the future of our innovations is going to be an extension of our intentions. And our intentions are to change how we care for and how others care for us. And so that's pretty incredible to think about how this is going to pan out in the next few years. And it's always a pleasure to sit down and talk with you, Marc. But I specifically love how you use the word trenches. And yes, I am in the trenches with you, and I will be here to share this story and the work and the progress of you and your team, because it's pretty incredible how we are changing the landscape of healthcare globally and how we're doing that alongside of our customers. And so there's big things to come. And I love this moment that we had right now. And there was so much more to talk about. So I think I'll see you in about the next 6 months, maybe, and we'll touch base again on where we left off. But now I actually want to turn it over to something that Marc alluded to. And we are going to hear from one of our customers who we have worked hand in hand with as they have beta tested. They've been our beta testing partner for the Oracle Health Clinical Digital Assistant. And for that, I'm going to hand it off to Dr. Jigar Patel, Senior Director of Healthcare Solutions for Oracle Health. Jigar?
Thank you for the handoff, Shauna. I know Marc is extremely excited about the work we've accomplished, and so am I. Before I jump into my portion of the presentation, I wanted to remind everyone that we do have a team on hand ready to answer your questions. Please make sure you get the most out of this webcast by leveraging the Zoom Q&A function as we go to make this a two-way conversation and get your questions answered. For those of you who joined us in January's Inside Access webcast, you may recall that I've been working on a product called Oracle Health Clinical Digital Assistant. In that January webcast, I shared some of the work that we've been doing in collaboration with our beta testing partners. With me today is some of the team at the Billings Clinic, one of our beta testing partners who has been invaluable in getting us to this point. I'm happy to be joined by CIO Justin Ott, CMIO Dr. Randy Thompson, family medicine physician and one of our end users, Dr. Jessica Cozens, and IT informatics, Shelley Phelps. Thank you all for joining us today. And I think we're just going to jump right in. Justin, let me start with you. Could you please tell us about the Billings Clinic?
You bet. Thank you, Dr. Patel. So the Billings Clinic was founded almost 100 years ago, and we are the region's largest healthcare system. We are a physician-led, Montana-based, community-owned, governed, not-for-profit organization that is integrated multi-specialty group practice with 336 beds. Billings Clinic has more than 4,500 employees, including nearly 600 physicians and non-physician providers, and advanced practice practitioners, offering more than 80 specialties. Our health system is made up of over 16 managed critical access hospitals, all participating in a clinical integrated medical record, but remain fully independent with their respective communities. Billings Clinic is an exclusive Mayo Clinic care partner for Montana and Northern Wyoming. Billings Clinic vision is to be the national leader in providing the best clinical quality, patient safety, service, and value. We have the first level 1 trauma and comprehensive stroke center in the state. We also have achieved Magnet's top status for quality, while also achieving a Leapfrog A score and a CMS 5-star ranking. We have been with Cerner, or Oracle Health now, since 1999, and we're one of the pioneers around adding rural critical access hospitals into an electronic health record.
Thanks, Justin. Thank you for that. So tell us about how you got into the beta program and what you've been doing related to Oracle Clinical Digital Assistant.
I'm going to kick that over to Dr. Thompson. He's been the key leader in that area for our organization.
Fantastic. Randy?
Yeah, so I think there are several notable aspects of this project that I'd like to talk about. First of all, I was excited when we were offered the opportunity to participate in the beta testing for a variety of reasons, the topmost of this being, this is actually a technology that could help providers and not hurt them. A lot of times when a new technology comes out, it actually ends up hurting providers and making their workflow less efficient and adding more clicks, but this is a solution that can actually help them. We know that providers need to talk to patients, and then they need to create documentation of that conversation that actually reflects what was said and create a document that makes sense. Oracle Clinical Digital Assistant does just that. It listens to the conversation between a provider and a patient and creates a document that makes sense. This allows the provider to spend more face-to-face time talking with the patient, less time facing the computer. It decreases their documentation time and allows them to go home more often with their documentation completed and spending less time at home documenting with pajama time. This leads to increased provider satisfaction with the EHR, which is not easy to do these days, and also increases their satisfaction with their job.
Yep.
The second thing that I'm kind of excited about is that Oracle Health actually involved the end users of the product in the development and testing of that solution. They reached out and partnered with certain organizations to help them create the solution. And so Oracle Health really did a good job of listening to the feedback and integrating that feedback into the solution. I was initially a little bit skeptical about how engaged our providers would be with testing this, but after they saw the potential of the solution, they really got excited and were engaged and provided robust feedback to Oracle. And I think the third thing I want to talk about is I'm really impressed with Oracle Health, and they actually delivered on their commitment to make this generally available by June. And I will say I was initially skeptical given our previous experience with Cerner and maybe the focus on delivering on the timeline, but Oracle Health has delivered and delivered a great product. So I'm really excited about this opportunity. Thank you.
Thanks, Dr. Thompson. Appreciate that. The most important thing I took out of that whole thing was notes that mean something. We've heard over and over, we have colleagues all over the nation that tend to do notes that don't convey well what actually happened. EHRs don't necessarily help, but when you get a general surgeon's note that's understandable, it's actually really, really helpful to the primary care physicians. So let's dive into the beta experience a little bit more, Justin. I'll start with you and love to hear from Shelley as well. Justin, do you think you could shine a little light more on the technical aspects of the process?
Well, so I think there's a couple of pieces on that we want to jump into. The technical aspect is remarkable because now it can be utilized from the simplicity of a phone, and the face-to-face time that a patient and a provider can spend is a lot more, and it's a lot more personable. I think one of the things that I'm most excited about that I've seen with this interactions and this beta testing with Oracle is how this is truly a partnership, and how this beta test program has been. We're providing feedback, and that feedback is getting addressed and changed, and the product is that much better, that much quicker. And so I think that's very key, and that's very apparent of what Oracle Health and how important this is to them and what they've done to make this a successful solution moving forward. I'll kick it over to Shelley. I think Shelley's got a lot more context that she can provide.
Yep.
Thanks,
Shelley,
Jeff.
with your role as an experienced supporting the providers, what are some of the best ways to get them engaged and train them in addition to whatever else you've got from a technical aspect?
So I was very surprised also, like Dr. Thompson said, we threw a net out there and reached out to several primary care providers, and there was no reluctance. They just said, okay, we'll do this. It was a pretty easy hook. And once they started using it, the feedback that they gave was positive. And I think you heard this from Dr. Thompson, that I too was very skeptical. I've been part of our Cerner implementation back in 2004 until now. And we've had these partnerships before with beta testing, and we've had somewhat lukewarm results. And so I was skeptical also, but really immediately was surprised at how quickly things turned around. We gave feedback. That feedback was taken and changes were made. So I think having that really helped the physicians also get buy-in and want to use the tool and provide that feedback, because once they saw their suggestions were taken and changes were made, they were ready to give some more feedback. And
That's great to hear.
yeah, as far as the implementation, I would say this has probably been one of the most low-key, pretty easy implementations. Download the app, get logged into it, start using it in your patient experiences and in the room, and that's all there is. We trained it, we set aside 30 minutes for the providers, but it really didn't take that long because the learning curve is very low. And after each one of the training sessions that we had people that were using it right afterwards. They were asking to use it. Can I go back and use this afternoon? So I thought that was very promising also.
That's fantastic to hear. So Dr. Cozens, as an end user, how would you say clinical digital assistant has changed your practice so far?
Yeah, so I'm also one of the CMIOs, and so I'm kind of privy to the feedback that all of the providers have given. And so I know that we've gotten lots of providers say, and we had one person say it's cut my documentation time in half. I had another one who has two very young children who said, I'm now home by dinner time every night and get to spend more time with my kids, and my notes are done. And so that's fantastic. I think, one of the biggest things for me is that it's really decreased the cognitive burden of creating notes, because when I sit down to complete the notes, to read what's there and edit it, I already have a rough draft done. And so instead of having to create the note from scratch, I can just read what the clinical digital assistant has provided and then edit it and tweak it the way that I want it to be. So it's a lot less anxiety provoking to have a full day of patients, because it is that work is already done for me.
Thanks, Jessica. I appreciate that. So kind of next question to the group, kind of opening it up. The clinical digital assistant is meant to facilitate an improved work-life balance and give time back to clinicians, as Jessica mentioned. We're wanting to help them to get out earlier, spend more time with their families, and get to bed earlier, obviously, also. Not worried about getting all of their documentation done after hours is really important. With that, I've been there. I've got a lot of stories myself about the beta process. But what makes you eager about the broader rollout to clinicians and getting their feedback and how we could potentially change their practice?
I can start on this one. So I think moving forward, opening this up to more specialties is key. And we're at that point now to start doing that. And again, we've got people already saying, I'll do it, pick me, I'll do it. I think one of the things that really helps with this is that just the engagement between the engineers. So each meeting that we've had with primary care, we had engineers on the phone also, and the providers were giving that feedback directly to the people that were developing the tool. And that's huge. And so, like I said before, when the providers saw the feedback that they were giving turned into real life experience, that was, stuff we haven't seen before. So I think that's one of the exciting things moving forward.
So Dr. Thompson or Justin, what else excites you about this solution, or what stories have you heard from your colleagues at Billings Clinic?
So I'll give you my perspective, and I would love to hear Dr. Thompson. So just looking at this as the foundational model for what AI can do in healthcare, and how this technology and this approach could be applied to many different areas within a healthcare organization, I think is really, really exciting. I think we're just seeing what's possible, and that gets everybody really, really excited, and opens the door to say, oh, what if we could go down this route? What if we could use it for this? What if? And I think that's going to be key. And I think setting those expectations up front and setting that excitement is going to go a long ways. Dr. Thompson?
Yeah, and I would just like to echo a little bit about what Shelley said. For me, what's most exciting is not just this particular piece of the solution. That's a start. I'm really excited that Oracle promised us something and then delivered it on time with a product that is better than we thought.
Any other thoughts or comments, Shelley or Dr. Cozens?
Yeah, I'll say I think probably just to echo some of the things that my colleagues have said, how much Oracle has listened to us and taken our feedback into account. For example, when this first started, it created a node and it built a problem list based on the things that it heard you talking about with the patients. And we said, we'd really like to integrate the problem list that we've already created within the workflow M page. And so now that's done. Now we can select problems and it pulls it in. It's now working to integrate anything that you have pre-charted in the M page in the node, which is huge. If you do chart prep beforehand, maybe you have a health maintenance checklist that you're going through something, you can still do that and it's going to pull in the note. So yeah, I'm just really excited to see where this keeps going and how we can keep making everybody's documentation better and their work-life balance better.
Thank you. So I want to thank Billings Clinic for being a great beta testing partner. I also want to shout out to the product engineering team, product development team, the infrastructure team I get to work with every day. They are fantastic in doing great work to bring this solution to the market. So Justin, Dr. Thompson, and Cozens, and Shelley, thank you so much for your time. Unfortunately, we're out of time. We could talk all day about your experiences because this is such an exciting time. And I've got stories from all of our beta testing partners that are very similar, and they're very encouraging to me as somebody who's been doing this for so long. But we're out of time, as I mentioned. So thank you all for your time. Again, thank you for being a beta partner. As I noted before we got started, the work and the feedback from your team, as well as the beta partners, truly has been invaluable as we work to deliver the tools that help clinicians be more efficient and hopefully bring back some joy in practicing medicine again. So with that, let me hand it back to you, Shauna.
Well, thank you, Dr. Patel and the Billings Clinic team for giving us all some inside access into what's helped bring Oracle Health Clinical Digital Assistant to life. To echo Dr. Patel's sentiment, we are truly grateful to all of our beta partners around the world who work hand in hand with us across all of our innovations. Your work is truly helping us in our goal to improve healthcare and health outcomes globally. Well, before we close, I wanted to remind everyone that our team will remain on the line for just a little while to address any of those questions or feedback that you may have. Please continue to submit them in the Q&A feature, and thank you so much for doing that. Also, please make sure to fill out the survey and to let us know how we did today. We want to hear from you. Once again, I'm so honored to be able to serve you, our customers, and bring you these updates and insights. And on behalf of Marc, Dr. Patel, and the Billings Clinic team, and everyone here at Oracle Health, thank you for joining another edition of Inside Access. And we look forward to seeing you for our next episode on August 20th. Until then, have a wonderful day.